My mother was diagnosed with breast cancer. Being around hospitals and doctors and just medicine in general, it was really a driving force for me to become ultimately a physician and a surgeon. But as my training began to evolve and going into general surgery as that first step, that's when I became exposed to plastic surgery. But I quickly was able to see patients that were very similar to my mother in some regards of having breast cancer and having treatment from that from a surgical standpoint. But not only the surgery to remove the disease, but then the reconstruction to restore what is lost. We could line up 100 people and we're all different. And that also goes into even how when a woman is affected by breast cancer and then the types of reconstruction. And there's different stages of where reconstruction can be done. And so we kind of separate those categories into immediate reconstruction and delayed reconstruction. Immediate is reconstruction that's considered at the time of mastectomy. And there's a great advantage to this because it's less surgery for the patient. And then there's delayed, where in this circumstance, the patient had a mastectomy in the past, and maybe she elected to not have reconstruction or was not a candidate at that time. Here at Shannon right now, we are offering implant-based reconstruction. And what that means is that can be, once the breast is removed, that volume and that shape of the breast is restored with an implant or what's called a tissue expander, which is a temporary implant. The reason there would be if we need to adjust the size of the breast, if we need to recruit more skin just based on the mastectomy, that we can't at the immediate time replace the amount of volume that's lost. Other techniques such as fat grafting, by removing fat that we don't want, which all of us can all find some areas where we want to get rid of that, but we're able to take fat from the abdomen, the hips, the thighs, and then using that fat to give the final touches on the breast reconstruction. There's also different places that the implant or the expander can be put in. After many studies and experience that I've had, I've found that one of the best placements for those are what we call a prepectoral pocket. And that means that the construction is built above the muscle. This allows for a more natural appearance and result in the reconstruction, and also an easier recovery. There are not a lot of options without travel outside of San Angelo. And so, yes, those opportunities for reconstruction have been in other cities that many have to travel hours to go to, and that have done, but it's not only at the time of surgery that becomes a challenge. It becomes a challenge with your follow-ups. We can be at home, we have our family here to support us, and to know what we're going through. You heal better, you recover better. With breast reconstruction and breast surgery, there is a team. It goes with the breast surgeon that's performing the mastectomy, the oncologist, and then the radiation oncologist if that's needed, and our other medical colleagues, and all coming together. And that's all been here and that's been established. But the reconstructive component hasn't been. It's the one piece that we've been missing. And so I'm excited that I get to be a part of that.